Good evening, Norman. As many of you know, Governor Stitt has announced his plan to reopen the state. While I'm glad he is working on a plan, I find our lack of testing capabilities and plan for contact tracing very troubling. In addition to a downward trend of new cases and a prepared healthcare system, medical professionals tell us time and time again that we must also have those tools in place if we are going to start opening up, so we can identify and isolate new cases as they appear. This is how we avoid that second spike of new cases that you may be hearing about. Like Oklahoma City, Tulsa, and more, our current stay-at-home order will remain in place through April 30th. While I am just as excited about opening up businesses and getting Normanites back to work as many of you are, we will not do so until it is safe, not just in the immediate future, but in the long term as well. I have mentioned keeping our eyes on the long game, and without the tools of testing and contact tracing, we are setting ourselves up for an unmanageable return of COVID-19. We must have the ability to be proactive in controlling COVID-19 as well as reactive. But speaking of testing, OU Medicine, the University of Oklahoma, and the Oklahoma Medical Research Foundation announced today that we will soon see increased capacity and inventory for testing. They anticipate that this new capacity will generate approximately 1,600 tests per day, with results ready in 3 to 4 hours. Our emergency management team has been working closely with the Cleveland County Health Department, and we are formulating a local plan for contact tracing in our city. After speaking with medical professionals, I believe that with this new influx of testing capacity, and if we can get a solid contact tracing plan in place soon, we are still on track to begin our phased opening on May 1st, so long as the data supporting a downward trend of new cases is there. If data shows we cannot open safely on May 1st, we won't do it. It's that simple. A final decision will be made next Tuesday. Just a reminder that if you need testing now, contact the Cleveland County Health Department for more information and to make an appointment for their curbside test. This test is free and no doctor referral or insurance is required. Call 321-4048 for more information. The Reboot Norman plan, our phased approach to the restoration of businesses while protecting those most vulnerable, is in the works. We also have the President's plan to refer to. Everyone needs to begin preparing for the new normal of life in our community after May 1st. Many industries have provided guidance on how to safely open. This could include appointment-only business, required facial coverings for employees, and a decrease in permitted capacity. Individuals need to wear facial coverings when out in public and continue to wash hands frequently. While businesses may be planning to reopen, the size of permitted social gatherings will remain low throughout the summer. We will have more information on the details of this plan next week when we have more information about the trends of reported cases in Norman. And decisions will continue to be driven by data and the advice from our medical community. Thank you, Norman. Hang in there. Stay safe and stay home.
For more information, visit www.coronavirus.normanok.gov and follow all of our social media channels.